Hi, I'm Jenny Thomas, and I'm a general pediatrician. I'm also a breastfeeding and lactation medicine specialist, and I'm the lead author on the AAP's new clinical report on ankylosing in breastfed infants. Ankylosing happens because the tongue doesn't move the way that we need it to. It happens because the floor of the mouth anchors the tongue, and so when you try to elevate it, it doesn't work as well. People call it tongue tie because it seems like it's tied to the bottom of the mouth.
Now, tongue tie, which is known as ankylosing, is a condition present at birth that restricts the movement of a baby's tongue. The underside of the tongue is connected to the floor of the mouth by a piece of tissue known as the lingual frenulum. In babies with a tongue tie, the frenulum is thicker or tighter or shorter than usual, and this restricts the movement of their tongue, and it can cause problems with feeding. Now, a tongue tie can involve the entire underside of the tongue or just part of it. In terms of how common it is, well, it can be seen in almost 1 in 10 babies, and typically it's more common in boys than girls. About half of babies with a tongue tie have got someone else in the family who also has one. So, for example, another brother or sister.
The procedure for correcting tongue tie involves lifting the tongue and removing the connective tissue that's underneath the tongue. We just cut it so that that tongue is released and is not stuck to the floor of the mouth any longer. The amount of procedures being done for tongue tie have exponentially grown over the past several years. At least part of that is because we've had so many more breastfeeding families in the past couple of years. And there's some difficulties a lot of times with breastfeeding relationships. And sometimes that procedure looks so tempting, like it's going to fix everything. And it may not do that.
So how might you know if your baby has got a tongue tie? Well, if you breastfeed your baby, you might find that your baby has got difficulty attaching to the breast or staying attached. The baby feeds for a long time or has a short break and then feeds again. They can be unsettled and appear to be hungry most of the time. They might not be gaining weight as quickly as they should, or they could be very windy with excessive hiccups or flatulence or farting. You may also notice that they have difficulty controlling the milk flow. This is presented usually by the baby coughing or choking, and they may make clicking noises when feeding. You yourself might have sore or damaged nipples. You might not produce enough milk. You may get mastitis, which is inflammation of the breast, more than once, and you may also just feel exhausted from having frequent feeding and having an unsettled baby. Now, if your baby's bottle fed, you might find that your baby is again taking a long time to feed. They only take a small amount of milk at each feed. They dribble a lot during the feed. They can again be very windy. They may again not be gaining weight as quickly as they should. Now, of course, many of these symptoms are very common in new babies, and just because they have them, so for example, they're very windy, doesn't mean that they have tongue tie.
Pressures on social media for families where if you haven't gotten your kid checked for ties, that maybe you're not doing everything for that relationship. What we are hoping is that you go see your pediatrician to help with those breastfeeding difficulties.
But if you've got any concerns, especially about how your baby's feeding or putting on weight, then speak to your health provider. Now, if a tongue tie is suspected, a feeding assessment can take place. With your permission, a referral will be made to a tongue tie specialist. A referral doesn't mean that your baby will definitely be offered treatment, but the specialist will be looking at many different factors and will talk you through the findings and options that are available to you.